Coming up next on Arizona Horizon, we'll get the wherefores and whatnots on Arizona's soon-to-be implemented health insurance marketplace. And we'll learn about a local collective space that gives startup businesses a place to start up. Those stories next on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of Eight, members of your Arizona PBS station. Thank you.
Good evening and welcome to Arizona Horizon. I'm Ted Simons. A group looking to overturn recent election law changes turned in signatures to get the referendum on the 2014 November ballot. The election laws are set to go into effect Friday, but they could be put on hold if enough valid signatures have been collected. Opponents of the election reform say that the changes passed by the legislature and signed by the governor are designed to suppress minority voters and keep Republicans in power. Enrollment for Arizona's health insurance marketplace begins in just a few weeks. The insurance exchange is part of the Affordable Health Care Act, which kicks in at the start of next year. David Sion is the regional administrator of the Centers for Medicare and Medicaid Services in San Francisco. His office will be in charge of Arizona's health exchange. Good to have you here.
Thank you.
Let's start with, there's so much to talk about here. Let's define terms. The health insurance marketplace. What are we talking about?
We're talking about something as simple as a marketplace where you would go and there are vendors selling their produce, and you can look at the produce at the different vendors and decide what you like. It's that simple of a concept, so that we'll have health plans available for people to choose from, so people have choice. They'll be available on an internet site. It can also be accessed by telephone operators, or even you can apply on paper for this thing. But basically, there you've got a choice of health plans, so you have a choice that may represent different doctors and hospitals that are available. You've got eligibility for subsidies. So there's almost 1 million people in Arizona right now that don't have health insurance. Some studies show that somebody dies every day because they don't have health insurance in Arizona, that they don't get care that they need. And so we're going to fix that, because more than half of those people are going to be eligible for subsidies under the law that will reduce the premiums that they have to pay. But perhaps the most important thing is everyone's eligible as long as they're a citizen or a legal resident of the United States and have an address that they can use. There is no discrimination for people because they were ill in the past, or they may have a genetic condition or something like that. There's none of that. Everyone's welcome to have insurance now.
Interesting. And again, no denial due to illness, no denial due to medical condition.
That's right.
All right. Sounds like one-stop shopping for basically the essentials.
What we're trying to do, right, is to facilitate this marketplace where you go, and whether it turns out that you might be eligible for the Access Medicaid program if your income is lower, or for one of these subsidies, or if you'd simply like to buy different health insurance and shop, you can do that. But when you look at automobiles, you have the large SUV and you have the convertible, you have these categories. Same thing here. 4 categories of plans: bronze, silver, gold, platinum. The difference there is you can pay a higher premium and then have lower costs during the year, or you could choose a lower premium, take a little bit of a chance, and then maybe you'll save money if you don't have much needs. But they're all going to cover the same 10 essential benefits, and that's very important.
Talk about those essential benefits. Are we talking hospitalization, drugs, these sorts of things?
We're talking hospitalization, outpatient prescriptions, outpatient care, physician services, laboratory, maternity and new baby care, basically all the things that you need to take care of your health.
And those are all required.
All the plans are required to offer the 10 essential benefits. Some may go a little further and have a richer benefit, but then the premium might be higher.
And again, we're talking basics here. These are all private firms.
That's right. What it is a marketplace of individual vendors, if you will, just like the example of a farmer's market. So it's not government insurance. Our role here, as insurance commissioners do as well, is to simply regulate that marketplace so that the issuers can benefit from a healthy competition, and the taxpayers and consumers in this case have an opportunity to make a meaningful choice.
Do we have an idea of how much these health plans will cost? Any level at all?
Right. We are not going to post the premiums until we have signed agreements with all of the plans. So that we have a full story to tell. We're in the middle of finalizing those discussions now, so I can guarantee you that on October 1st, folks will be looking at the premiums. But I can tell you other states who've decided to run their own exchange, California, for example, Massachusetts, have published their rates, and they're competitive and in many cases better than what was expected.
And you can find out, again, if you're eligible for what you had referred to in the past, these low costs. Are there free plans that folks could be eligible for as well?
Okay. Let's start from the bottom.
Yes.
So for folks that have a very low income, less than 133% of the poverty level, or let's make it simpler, less than $15,000 for an individual, 31 for a family of 4, those folks don't pay anything for health insurance because they qualify for access. And if they come to our health insurance marketplace portal or one of our navigators helps them, when our system determines you're eligible to be in Arizona's Medicaid program, that's where they're going to go. The system's going to take them over there and get them enrolled. If their income is higher than that, then the system's going to take a look and see if they're eligible for a reduction in the cost of their insurance. That happens on a scale from that 133% all the way up to 400% of the federal poverty level, which doesn't mean much to the viewers, but $94,200 probably does mean something. That is the level at which the subsidy would stop for a family of 4, and after that you're just buying insurance. This program isn't just for poor people or people that can't afford insurance, because anybody can go to the exchange, as I said, and buy insurance. But what's important here is there's a lot of people that we would think of as, middle class folks that are going to get a reduction in the cost of their insurance because we're going to pay part of the premium for them, and they'll just pay the difference.
Interesting. Children's health insurance programs, are they out there?
Well, children, lower income children have access to care through Arizona's Access program, yes. But when we get into the people in this middle class, these programs are available for kids, moms, whomever. You may have a family where my employer provides health insurance, but not for my son. I can buy a policy on the exchange for my son, regardless of his health status.
Okay, everything you've talked about right now makes sense when we're talking about it. When you go to the computer on October 1st, or go to the telephone, or I guess there's a variety, we'll talk
right.
about that in a second here too. But when you go there, is this laid out for you? Is it a file? How complicated is the application process?
Well, I can tell you I was at our headquarters back east last week and actually had an opportunity to test drive the application process myself. And it's really quite simple because it asks you one question at a time. Where do you live? What do you expect your income to be next year? A few facts like this. The system behind the scenes goes out and verifies that these facts are correct using a facility that we call the Hub, which just yesterday passed its tests for readiness to start. And then it says, discount, as they say on the TV commercials. It might say to you that you're eligible for a reduction in your premium of a certain amount, and then you can go on and browse the plans that are available. This reduction comes in the form of, little wonkish, an advanced premium tax credit, advanced paid tax credit. So what you're doing is you're getting, our friends in the Internal Revenue Service are actually giving you money. They're going to give money every month. When you pay your premium, they'll pay a share of it, or you can delay it and take your tax credit later. But the point is, when you get to the tax return in the following year, you're going to square up this credit. So if, for example, you were unemployed and then you get employed during the year,
yes.
You can go back to the marketplace and say, my income has changed, and then they'll adjust that for you. Just like you might adjust your withholding if you had another child or something like that. And then that's where it gets adjudicated. So if we paid someone too much, it'll come back. If we didn't pay as much as we should have, let's say you lost your job in the middle of the year and you didn't tell us, you could be eligible to recover some money there as well.
So again, when you get to the application process, it's kind of like a variety of things you do online where you can get fitted for a golf ball or something like that. You press a thing, continue. You press a thing, continue. And right. This will, because what you're explaining can be complicated, especially to folks who may not be all that well versed in the nomenclature of insurance and all this legalese stuff.
Right.
They want to be able to know, A, can they fit out the application? And B, once you're filling it out and I have options, can I figure out what the options
right.
offer?
And this is the thing, the transparency, the opportunity for choice that we think is really powerful. So, if I have a kid, let's say she's got Asperger's, it's a problem that some kids have, and I need to buy insurance, I'm going to have to go to these different insurers, fill out some pretty sophisticated things about the illnesses that they've had and everything, and then half of them are going to say no, and the rest of them, maybe they're going to offer me products at different prices that don't match up. So there's no way I'm going to really make an good choice. Here, all the plans offer the same benefit package, the basic package. They're all available to me, and they are in lockstep with this bronze, silver, gold thing where I can figure out what premium I want to pay versus how much risk I want to bear. That's a much more logical way to make things work. We have a capitalist system in our country, and it's great, but sometimes these systems are helped by having a little structure to make the marketplace work better.
And the structure means comparing prices, comparing benefits, comparing quality of plans?
Well, now that's an interesting point. So the plans that will be offered on October 1st, or shall I say the products, as the issuers call them, they didn't exist prior to the 1st. So while we could give you information about this insurance company is pretty good or that one, it really wouldn't work so well. So what we're going to see is we'll know if it's a company that has accreditation or has some qualification that's worth knowing. But in terms of rating the plans, that's going to happen when we get into the next year and people have experience with the actual products in the exchange from that issuer.
I don't want to jump too far ahead, but will those ratings be like Amazon, where you just give it 5 stars or something like this, or say I like it, I don't? How do you figure that out?
We've been in this business a long time. So I've worked for CMS for 34 years. We've been administering the Medicare program since 1964. And about half the people that are in the Medicare program here in Arizona actually get their Medicare from a private plan. They're called Medicare Advantage plans. And all the folks who have the Medicare prescription drug program get that from a private plan. The way we do this is we have an engine, very much like the marketplace, called the Plan Finder. And if you're a Medicare beneficiary and you're interested in a drug plan, you go in there and say, this is where I live, this is the pharmacy I like, I need this drug in this dosage and this one and that one, and so forth. And then we pull the lever and the program figures out this program is going to have the cheapest overall cost for you, considering your dosage and all these other things. And then there's this one and that one. And then we give the plans 1 to 5 stars. And as a matter of fact, for the past few years, we did a demonstration in the Medicare Advantage side where we paid the plans that had 5 stars more money every month, which they used to enroll more people, and we drove people toward quality plans. And that's exactly what's going to happen in the marketplace. We will tell people the plans that have a higher satisfaction, we'll survey people, and then drive people toward those. And we're also going to look for plans that get better health outcomes by making sure people have preventive services and the like.
So there will be accountability in that system relatively soon?
Relatively soon. Yes.
Relatively. Okay. All right. Again, I'm back now trying to figure out what I'm doing here on October 1st, 2nd, or 3rd. And I figured out, I've gone through the process, I've continued, I've done everything, I've made my choices. I enter, and whatever the screen says, thank you, good luck, and God bless. What if November comes and I decide, well, I think I want to change that. I'm not sure I want to go with Plan A here. I may want to go with Plan B with this other company. How often can you change?
Right. I gave a talk today, and a gentleman compared this, in his example, to a sale at a big box retailer where the store was going to close on a particular night, and then you could line up outside and there'd be a 70% discount in the morning, and everybody had to be there at once, and people got mobbed at the store like on Thanksgiving. This is not like that. There's nothing special about October 1st. The first enrollment period is 6 months long. So people have until March to decide if they want to participate. You can go on, go through the application, and save it, much as you would start a shopping cart in one of the other internet sites, and think about it. So the way this works is you're going to work through the business about the subsidy. If it looks like you're eligible for that, then you're going to say, okay, let me see the plans. And then you're going to see the plans and their information, and you're going to pick one. And then when you pick one, the computer's going to say, thanks very much, and welcome to XXX insurance plan, and now you'll be doing the particulars with them of how you want to handle paying your premium, which doctor you'd like to see, and so forth. Or you could get there and say, I want to think about this some more. I want to talk to my friend who's a nurse. I want to talk to my cousin, whatever. We think caregivers and family and pastors and teachers are really important in this process. Not a lot of people make this decision for themselves. I mean, frankly, I'm hoping for some of the younger folks who may have a little trouble with this. Mom's going to say, you know what, you need to have health insurance. Maybe even help them pay for it. So it's kind of a family and community thing. And I love working here in Arizona because we have so many partners in the community, in the healthcare community, that are really interested in helping people find their way through and get the right coverage.
Should folks be preparing now to enroll, or is it just basically wait till October 1st and take it from there?
You can go on our healthcare.gov website today and learn about how coverage works, what the benefits are, how the reduction works for those people that qualify for the advanced paid tax credit. But you really don't have to do anything much but wait a little bit. And then in October, as I said, you've got plenty of time. And I didn't answer your question, let me be clear. If you choose a plan in October and change your mind in November, remember that the coverage doesn't start until January 1st. So the plan that you're enrolled in on December 15th, that's your plan, and now you're in. For people who decide to go a little slower, their start dates will be February 1st, March 1st, April 1st, then we're done, and it becomes an annual event after that.
Okay. And one more question. Businesses. We're talking about individuals for the most part here.
Right.
Anything special businesses need to be doing now to prepare for all this?
Well, there's a couple things that are important. First of all, the great majority of large businesses provide health insurance for their workers. They need to do that to attract quality talent. They don't need to be doing too much today. But when we get into the smaller businesses where jobs are often created, as we well know, we're helping businesses that have fewer than 25 employees by offering them the opportunity to purchase insurance through a special marketplace, we call it the SHOP, that has its own plans that will be available, has an 800 number, and there's a tax credit available that can be worth as much as 50% of the employer's contribution. This is important. If I want to start up a company and try to challenge Google, Google can give health insurance cheaply because they're a huge company. I can't. Now I'm going to have that opportunity. I think that's going to be very important.
And again, for businesses, healthcare.gov, get your answers there?
They can go there, and that'll take them to the small business site.
Well, there's a lot of information there, David. Thank you so much for joining us, and we will see what happens come October 1st, 2nd, 3rd, and on forward.
We sure will.
Thank you.
Thank you.
In northwest Arizona, just off State Route 95, stands a peculiar monument to the town of Oatman. Oddly, the marker is 15 miles from the town it honors. Wedged into the Black Mountains, the mining town of Oatman was established at the turn of the century. By the 1930s, nearly 2 million ounces of gold had been extracted from the surrounding mines. The price of gold and World War II forced the closure of the mines in the 40s. The town was delivered another blow when in 1952, a stretch of Interstate 40 opened, siphoning off Oatman's lifeblood, Route 66 traffic. It quickly became a ghost town. Route 66 is again its lifeblood. Nostalgia for the Mother Road and the Old West draw tourists from all over the world. They walk the boardwalks, hang with the local gunfighters, and are followed around by Oatman's most famous residents, the Burros, descendants of those set free by miners years ago. Being closer to Nevada than the town itself, Oatman's misplaced monument is long forgotten, but the town is remembered daily.
Tonight's focus on Arizona technology and innovation looks at a unique workspace for creative minds. It's called Gangplank, and it's designed to be a place where a variety of startups can collaborate on a variety of things. Jade Meskill of Gangplank is here now to tell us more. Thank you so much for joining us.
Thanks for having me.
I'm trying to wrap my mind around this thing. Now, what exactly is Gangplank?
So Gangplank, it's a community of collaborative workspaces where we're trying to attract really a cross-section of creators. We get a lot of people who are in high tech because it naturally fits with them. Also musicians, artists, photographers, just that whole cross section of people who are doing really creative and interesting things, but also want to give back to their community.
Doing creative and interesting things together on your own? Are there individual spaces? Is everyone just riding skateboards around one big room like you see in Silicon Valley? What's going on here?
Well, we have had that happen, people riding skateboards around. You know, it's really up to the people that are participating to figure out how they're going to work together, what they want to create. Our idea is that the most creative solutions and ideas happen at the edges, with people who maybe aren't experts in their field, but are in another field, but are experts in their field, colliding with somebody who knows something totally different, right? They can come up with really exciting, brand new, fresh ideas by using their expertise in a place that they're very unfamiliar with.
So are specific issues addressed at specific times, or do you just show up and what?
Yeah, so there's no structure to how people have to participate in Gangplank. It is free for people to come and participate, but the idea is that you're giving back to the community in some way that you feel good about, that you might have a strength in. So say I'm really great at web design. Maybe I'll offer some classes to people in the community for free to come in and learn more about web design. Or maybe I might give back to some other nonprofit organization in the area that could benefit from that expertise.
But at Gangplank, there really are no seminars or meetings or classes, or are there?
There are. We have a thing called Gangplank Academy, where we'll offer structured classes for people who want to come in. So, for instance, tonight there's a photography class that has been going on for quite a few weeks now. Where there's an instructor, he's teaching people the benefits of digital photography and how to use it, how to take low light photographs, things like that. It's a structured environment, but he took the initiative to create that class on his own. Gangplank is providing the framework, the building, the things that he needs to successfully pull off that class.
And the idea would be that if I were starting a small business in some tech firm and I thought I may need to use digital photography in some way, shape, or form, I go to his class, I learn, I benefit.
Sure.
That kind of collaboration.
Yep, and I might meet some other people that could help me with that business.
And so I read that you were trading in what you call social capital.
Yes.
Explain.
So the idea behind social capital, it works just like regular capital in that you can have a net positive or you could be in debt, right? So if I do something that benefits the Gangplank community, I've earned some social capital. Now, there might be a time in my business or in my personal life where I might need to spend some of that social capital. So that social capital gives me influence within the community. So it's not a thing where we're keeping track of it in a bank account. It's much more free-flowing than that. But if I'm doing things that benefit people, I'm gaining in influence and gaining in that social capital.
Well, let's get back to the bank account here. Cost is free.
Yep.
You've got different locations, and obviously there's bricks and mortar here involved in some way, shape, or form. How is this stuff paid for?
Yep. People like to ask that question. For the first few years, we bootstrapped it. I run a consulting company. We thought this was a really crazy idea and wanted to try it out, so we paid for it ourselves. We had some extra space in our building, and we invited some other companies to come in and work with us. Nowadays, we partner with local municipalities and work with them on a services basis to provide them some economic development services. So they're benefiting from Gangplank's involvement in their city, and we use that money to pay for the bricks and mortar side of things.
So with the hope that if I do start my small company that benefited from taking that digital photography class, I will base it in Chandler or in the Valley somewhere, and thus the city benefits from their donation or their cooperation with Gangplank.
Correct. Yeah. We want to build really great local businesses that will stick around and continue to invest locally.
Was this modeled after any other group or organization?
Not necessarily. There's an idea of co-working out there where you might come and say you don't want to sign a lease for a desk or for an office. You could purchase it on a per day or per month basis as like a subscription. We were aware of that model. We wanted to do something very different because when we talk about social capital, real capital has a way of messing that up, right? Once we start talking about real dollars and cents, it becomes a landlord-tenant kind of relationship, and that's not what we were interested in. We wanted to free people up to be able to do whatever it was that they thought could give back.
Well, what if by freeing people up, someone designs the next great mousetrap? Are there intellectual property concerns? I say, hey, wait a minute, I was part of that thing there. You are now, initial public offerings of how much, goodness knows how many per share. I mean, intellectual property, how is that mixed in here?
So it's not a direct, we don't have any sort of agreements with anybody that we own any of their intellectual property or anything like that. We have a saying around Gangplank that stop worrying about people stealing your ideas, they're busy building better ones.
Okay, so but are people taking to that particular slogan? Because again, when people get success, altruism can sometimes take a hike.
That's very true, and we encourage people, if you're entering into a business arrangement, make it a business arrangement, right? Gangplank is not going to protect you from those intellectual property issues that you might have.
And there have been business arrangements, I would imagine.
Sure, we've had lots of successful partnerships form. People create new products together. We've seen a lot of really great stuff happen.
How many locations for Gangplank now in Arizona?
There's 3 in Arizona. Chandler is where we originally started, Avondale, and Tucson.
And It's any chances of growing here? Any plans for growing, or is it just kind of play it as it lays?
We're always open to new locations. What we look for is a city who is looking to try something different, who knows that they need to do something different in the economic development world. And we're looking for those great partners. We don't go out and plant locations. We work with people to help them grow new locations where they're at.
Building relationships and not transactions. It sounds fascinating.
Yeah.
Good luck to you.
Thank you.
Thank you. Thursday on Arizona Horizon, here are the pros and cons of pension spiking, a controversial method of beefing up public retirement packages. And a CPA will explain how married same-sex couples can now file joint tax returns. That's at 5:30 and 10 on the next Arizona Horizon. That is it for now. I'm Ted Simons. Thank you so much for joining us. You have a great evening.
Arizona Horizon is made possible by contributions from the Friends of 8, members of your Arizona PBS station. Thank you.